Standard precautions. They are the minimum infection prevention practices that apply to all patient care, regardless of suspected or confirmed infection status of the patient, and in any setting where healthcare is delivered, be it the OPD, wards, or laboratory. Standard precautions is one of the many different methods to achieve safety in healthcare. However, as you can see in the picture, there are multiple elements under standard precautions, which cover a wide range of activities performed in a healthcare facility and therefore make it a critical component of safety. Broadly speaking, there are 10 elements to standard precautions. They are hand hygiene, personal protective equipment, management of biomedical waste disposal, handling of hospital linens, management of spills, respiratory hygiene and cough etiquette, prevention of needle stick injuries and occupational exposure of healthcare workers through proper handling of sharps, environmental cleaning, and finally, handling of patient care equipment and patient isolation. Each element will be discussed in detail subsequently, with the focus on the ones relevant to the activities in a laboratory. The first is hand hygiene. Hand hygiene is one of the simplest, easiest, cheapest, and important measure to prevent the spread of infections among patients and healthcare workers. It prevents the transmission of infections through contact. There are 5 moments of hand hygiene while working in a healthcare facility. The first is before touching a patient. The second is before doing a procedure. The third is after performing a procedure with the risk of blood or body fluid exposure. The fourth is after touching a patient. And the fifth is after touching a patient's surroundings. Before performing hand hygiene, it is important to remember to remove your watch or any other jewelry worn on your fingers or hands. Next, ensure that you have taken adequate amount of liquid soap to wash both hands. There are 7 steps of hand washing. They are designed in such a way so as to ensure that all the areas on the front and back of the hand are cleaned thoroughly. It would benefit the viewer to actually do the steps of hand hygiene as they are being listed. Step 1. The palms are rubbed together. Step 2. The back of both hands are rubbed, one after the other. Step 3. The fingers are interlaced and rubbed. Step 4. The fingers are interlocked as shown in the picture and the back of the fingers are rubbed, one after the other. Step 5. The thumbs of both hands are rubbed in a rotating manner, one after the other. Step 6. The fingertips of one hand is rubbed on the palm of the other hand and then vice versa. And step 7. Both the wrists are rubbed in a rotating manner, one after the other. After completing the 7 steps of hand hygiene, rinse and dry the hands thoroughly, preferably with a disposable paper towel than a cloth towel, as it has a high chance of being contaminated since it is reused by every person working in the laboratory. For the same reason of being highly contaminated due to multiple use, liquid soap is preferred over a bar of soap, and elbow-operated taps are preferred to ordinary taps. Hand hygiene can be achieved using an alcohol-based hand rub or by washing hands with soap and water. Alcohol-based hand rub is the preferred method, except when the hands are visibly soiled with blood or body fluids, or after caring for patients with known or suspected infectious diarrhea. Then soap and water must be used. Dispense the adequate volume into the palm of one hand and then follow the 7 steps of hand hygiene. And this must be performed for 20 to 30 seconds at least. Hand washing with germicidal soap and water should be performed for 40 to 60 seconds. Wet the hands with water first. Next, dispense adequate soap and rub the hands vigorously, covering all surfaces of hands and fingers, following the 7 steps of hand hygiene. Rinse the hands with water and dry them thoroughly with a clean towel or tissue. You may use the towel or tissue to turn off the tap if elbow-operated taps are not available. Thus, avoid touching the tap. This is another way to prevent contamination of hands after hand washing. The second standard precaution is personal protective equipment or PPE. It refers to wearable equipment that is designed to protect the healthcare worker from exposure to or contact with infectious agents. Effectively, it covers personal clothing and skin. The kind of PPE to be used is decided based on the nature of interaction with patient and the potential for exposure to hazards. Sufficient and appropriate PPE must be provided and be accessible to all healthcare workers. Periodically, the available PPE must be reviewed. Gloves. They are used whenever there is a potential for contact with blood, body fluids, mucous membranes, non-intact skin, contaminated equipment, or while handling chemicals. Clean examination gloves are sufficient for most laboratory practices. Sterile gloves are not required. However, sterile gloves are required for collecting blood for microbiological culture. It is important to use gloves of appropriate fit. If too tight, then it exhausts the hand, and if too loose, then it affects the ability to work. Do not wear the same pair of gloves for more than one patient. Do not wash the gloves, and gloves must not be reused. While wearing gloves, do not touch your face and minimize the surfaces touched with gloved hands. Perform hand hygiene before and immediately after removing the gloves. Gowns. They are worn during procedures or activities where contact with blood, body fluids, or chemicals is anticipated. They are used to protect the skin and clothing of the healthcare worker. If feasible, do not wear the same gown for the care of more than one patient. Remove the gown and perform hand hygiene before leaving the patient's environment. Face masks, also called as procedure or surgical masks. They are used when there is a potential for contact with splashes or sprays of blood or body fluids. It may be used in combination with goggles or face shield to protect the healthcare worker's mouth, nose, and eyes. Sometimes it is also worn for patient protection, for example, while placing a catheter or injecting material into the spinal canal or subdural space. This protects the patient from exposure to infectious agents carried in the mouth or nose of the healthcare worker. Respirators. They are used for the respiratory protection, that is, to protect the healthcare worker from inhaling infectious aerosols. While surgical face masks are used only to cover the mouth and nose. It is important to understand the difference between the two and that surgical masks provide very minimal respiratory protection. If respirators are available, then N95 or higher respirators must be worn. While working in a tuberculosis laboratory, respirators are a must, particularly in places where liquid culture is done. Goggles and face shields are worn when there is a potential for splash or spray of blood, respiratory secretions, or other body fluids. Personal eyeglasses and contact lenses are not considered adequate eye protection. Goggles may be used along with face masks, or face shields may be used alone in order to protect the mouth, nose, and eyes. Foot protection. Closed-toe, comfortable shoes that have low heels should be worn to work in the laboratory or other areas where chemicals are present. It reduces injuries that may occur from spills, splashes, falling objects, slipping, and broken glass. Sandals or open-toed shoes must not be entertained in the laboratory. The third standard precaution is respiratory hygiene and cough etiquette. Provide space and place acute febrile respiratory symptomatic patients at least 1 meter away or apart from others. Visual alerts must be posted at the entrance to the respiratory isolation wards and tuberculosis laboratory. Tissues and masks must be made available in the common areas. All persons with signs and symptoms of a respiratory infection must be instructed to cover their mouth and nose with a disposable tissue when coughing or sneezing. Dispose used tissues in the nearest waste bin. Perform hand hygiene after contact with respiratory secretions, contaminated objects or materials, and even after disposing of the used tissue. If a tissue is not available, or if your hands are occupied while working in the laboratory, then cough or sneeze into your elbow but never into your hands, as the hands would get contaminated and then they would in turn contaminate every object or surface that is touched. The next is handling of sharps, which is discussed in detail separately. In brief, sharps, like needles, must be handled with care. Needles must be separated from syringes before disposal. They must be disposed of promptly after use into puncture-proof, leak-proof white containers placed close to the area of use. They must never be reused or recapped. Work practice controls, that is, behavioral changes, can go a long way in preventing accidental injuries from sharps. Biomedical waste management is also discussed in detail separately. In brief, the waste must be segregated at the source or point of generation as per the latest biomedical waste management rules. At no point should biomedical waste get mixed with the general waste. PPE must be worn by the housekeeping staff while handling the biomedical waste. Remember, it is important to keep the facility clean. The sixth standard precaution is decontamination of patient care equipment and devices. This includes equipment used in the wards which come in direct contact with the patient and other equipment used in the laboratory which come in contact with patient samples. Clean, disinfect, and reprocess reusable equipment appropriately. Follow the manufacturer's instructions for equipment decontamination and reusability. Refrigerators and freezers should be regularly inspected for the presence of broken vials or tubes containing infectious agents. Appropriate PPE must be worn while cleaning and disinfecting equipment. It is important to remove debris and organic contamination before disinfection. Standard Precaution 7. Environmental cleaning. Cleaning and disinfection of all patient care areas is important for frequently touched surfaces like the bed rails, bedside tables, commodes, doorknobs, sinks, and surfaces in close proximity to the patient. It is due to the failure to follow recommended procedures for cleaning and disinfection that leads to environmental reservoirs of pathogens. They can go on to cause outbreaks in hospitals. Please note that hepatitis B virus is stable in dried blood for at least 7 days, and it can be transmitted directly from contaminated surfaces to the skin or mucous membranes. Some of the common chemical disinfectants used in laboratories are 70% isopropyl alcohol. It is used as a surface disinfectant, but it is not the choice for cleaning spills. The next is sodium hypochlorite or bleach. Its activity is considerably reduced in the presence of organic matter. 1% dilution of sodium hypochlorite in water is an effective general disinfectant, particularly active against enveloped viruses. The disinfected area must be wiped down with 70% alcohol to inactivate the bleach. The next is phenolic compounds. They are effective against spores, viruses, molds, and bacteria. Cleaning the laboratory. Pre-cleaning is essential to achieve proper disinfection or sterilization, as most disinfectants are inactivated in the presence of organic matter. Removal of dirt, organic matter, and stains must be done by brushing, vacuuming, dry dusting, washing, or damp mopping. Workbenches and floors must be wiped down with 1% sodium hypochlorite routinely after working with infectious agents or clinical specimens, or after spills or splashes. Then the surface must be wiped with 70% isopropyl or ethyl alcohol to inactivate the bleach and prevent corrosion of the work benches. Other areas must be scheduled for cleaning on a weekly or monthly basis. Standard Precaution 8. Decontamination of spills. Please note that bleach or sodium hypochlorite solution must be prepared fresh on a daily basis. Its disinfectant activity is significantly reduced on storage and cannot be used for reliable deactivation of viruses. In case of a blood spill, follow the given steps to clean the spill. First, wear PPE. Gloves, mask, and goggles should be worn to protect from any splash while cleaning. Then, cover the spill with absorbent material like gauze or cotton. Pour 1% sodium hypochlorite solution over the absorbent material. Give it 30 minutes as contact time. Then, wipe off the soaked absorbent material from the area. Throw the wiped material into a yellow bag for incineration. Finally, wipe the surface with 1% sodium hypochlorite again and mop up to leave a clean area. To summarize, we went through what are standard precautions, its definition, its role in the safety of healthcare workers. We looked at the different components or elements of standard precautions, focusing mainly on the ones applicable in a laboratory. Under these elements, we looked at how standard precautions must be practiced and followed in a laboratory and healthcare facility. Thank you.